You also asked a question about the pandemic, and I can just very briefly tell you, we've worked with our partners here at the Harvard Chan School of Public Health, with Professor Michael Mina, for example, and others. But the one study that he has championed, and we are glad that we could support it, was, you have different kinds of tests entering the market now to check for COVID. There's the PCR test, which is very high sensitivity. You need low viral concentrations. You can check with PCR tests. And then there's the rapid antigen test, which only can check things at a low viral concentration. So basically, you got a gold standard test that is slower, but can check for lower viral concentration. And you got the antigen test, which is fast, but requires higher viral concentrations. Yeah. And sometimes I get the lower and higher mixed up, but I think I've got that right.
I read this article, so I'm with you.
Yeah, okay. And so what we did is with simulations showed that despite the fact that the PCR test can check things at low viral concentrations, the rapid antigen tests are actually better. If you're testing, if you're Harvard and you want to check all the student population, and then anybody who's found to be positive, you isolate, for example. The thought is that the PCR test would be better, but it turned out in simulations, we're able to show that these rapid antigen tests are actually better, just because the more, the PCR test gets returns that are slower to get back. And because it's more expensive, maybe you can't run it as frequently. So with that difference, it turns out that the rapid antigen tests are better. And Michael, of course, is the one who's been championing it. So we're very glad that we could support it via our study.